in the chat box. Welcome, everybody. My name is Brandon Ivy. I am Vice President of Sales and Marketing for Aroga's Club, logging in from Los Angeles, California. Thank you for being here tonight on this emergency presentation, or I like to call it a surprise presentation. Normally, we do not do one on Wednesday evenings, but today is not an average Wednesday. Today, we actually announced a brand new product launch for Aroga's Club. And as we always stated before, we've come a long way over the last 30 days since actually beginning of this year, a month and a half into 2017, with the new brand of Aroga's Club, what it means, what our focus is, and that Aroga's Club is a membership that gives you access to products, goods, and services at wholesale price. The whole purpose and point of the club is that you can save money on services that might be seen as a luxury and as a necessity in your day-to-day lives. We even added a marketing plan on top of that called Freedom Club Challenge that's designed to help those of you who work for it to be able to earn guaranteed extra income, or what I say bonuses, on top of the compensation plan at the same time to be able to pay your bills. And we'll talk about that at the end of this. It's going to be a short presentation because we're only talking about the new product launch, and that launch is now in the healthcare industry directly. We've always been known as a health and wellness company with our AcuPoint holograms. We're launching our essential oils product line in a couple of months, but now we are actually in the healthcare industry. Now, why would we make a move like this? Well, going in the same message as the Freedom Club, the average person has very specific needs and concerns in their day-to-day lives on why they're working 9-to-5 jobs, and that is to pay their bills. That is to survive. And most people, unfortunately, one of the biggest costs that most people don't budget for is healthcare. We budget for our cable, our internet, our cell phone, our electricity. We budget for our rent. Sometimes we even budget for our credit card payments. But the one thing we don't actually budget for is healthcare coverage. And we're just going by day to day, wishing and hoping that we remain healthy and that nothing bad happens to us, especially if you're 35 and under. You think you're invisible. Like, I'm never going to get sick. But the one thing that we can't beat is Father Time. And as we get older, the more we need to take care of our health. That's what Aroga's been good at as far as preventative health. But there are some things that are unavoidable, some things that happen that we do not plan for. And that's why it has always been called health insurance. And if you work a 9-to-5 job, then a lot of companies, at least a couple of decades ago, always give you full coverage. That's not so much the trend today. Today, the trend is more where you have to cover it yourself, especially if you're an independent contractor. If you are a business owner yourself, your job is to provide health coverage for your employees and for yourself. That can get very expensive, especially depending on the states you live in. I live in California. You just look at things like Cobra, it can be $600, $700 to $1,200 a month just for your family. We have had Obamacare, the Affordable Care Act, that said we're going to guarantee everybody that has health coverage. And while good intending and meaning, it's not perfect. And with the new administration in office right now, the fight is over whether or not we're going to repeal and replace, repeal it altogether with no replacement, or keep what works and improve on it. And all that fosters is an atmosphere of uncertainty for millions and millions of Americans who are not sure what's going to happen with their health coverage. So enter Aroga's Club, an Aroga's Club that is adding health care as an option. I want to make this point very clear. We are not an insurance company. Oh, I'm glad to see we even have Dr. Alan Boyer on the line. We're going to do question and answer with Dr. Boyer at the end of this presentation. But when we talk about the health club, what is it that we're going to offer our members, and how affordable is it for them as well? So first, let's talk about the health benefits for the entire family. Easy access to healthcare at significant savings. You have virtual doctor visits, eye care, dental procedures, prescriptions, telemed 24/7, 365 service, chiropractic, pet care, diabetic management, lab testing, help you stop smoking, and podiatry. The simplest and most affordable health savings program. We're going to save money on virtual doctor visits, dental, vision, and prescriptions. You'll be able to talk to a doctor in as little as 5 minutes. Access to over 200,000 dentists and savings up to 50% on dental procedures, including braces. Get as much as 50% off on all eye care, including glasses and contacts. You'll be able to save up to 90% on subscriptions at more than 64,000 pharmacies. And I want to break some of this down. When we say this is health benefits for the entire family, that's what it is. Health benefits. For example, access to over 200,000 dentists and savings. Saving up to 50% off. A lot of people avoid going to the dental, not just because they don't like the dentist, but because they can't afford it. How about 50% off? What about eye care? A lot of people don't get their eyes checked. Why? Because they can't afford it, and there's even health insurance companies out there that don't cover this, depending on whatever type of coverage you have. 50% off on all eye care, including glasses and contacts. What about subscriptions? This is where a lot of families are really hurt because they can't afford the prescriptions. Save up to 90% at more than 64,000 pharmacies. And again, the most simplest and most affordable health savings program. What's the cost? The cost we're looking at to be a member of Aroga's Club is $99.95. We have a basic plan and we have a premium plan. The basic plan per month at $29.95 is going to include telemedicine, dental care, vision care, prescription medicine, chiropractic care, hearing care, help stop smoking, and financial counseling. Now, if you want the premium plan for $10 more, it has everything that the basic plan has, plus pet care. You realize I was talking to Bob Daves about this, and Bob, I think he was saying something like $7,000 for the year that you spent on pet care. You have orthodontic care, lab testing, STD testing, diabetic management, medical bill advocacy, counseling services, imaging services, weight loss help, and tax services. Now, the whole point of being a member is that you're going to get all of this at a discounted price. And we're not insurance, we're a benefits plan. And what that means is it's going to give you a little bit of peace of mind and the convenience of being able to get access to doctors without having to actually go and set up a doctor visit. I don't know about you, but one thing you talk to my parents. Well, I was born premature, and as a kid, I had chronic ear infection, and I was always at the doctor. And then growing up, since I played sports, I was always in the doctors for something, broken bones. So the nurses knew me at the hospitals that I went to, at Kaiser Permanente out here in California. They knew me. I was there so often. And as a result, I hate doctors. Not meaning doctors themselves, but the hospitals. I hate going to hospitals. I hate sitting in the waiting rooms. I hate the whole process. I cringe every time I've got to do it. You know, a lot of you know my story that I had sudden rapid hearing loss this past August when I turned 40 years old. And I just got an MRI done last week. I hated it. They made it as pleasant as can be. I just don't like being in the hospital. So you're telling me that I can call up the doctor and within an hour or so be able to be on the phone and tell them whatever my issues or problems are, whether it's video conferencing or on the phone, and be able to get the help that I need and a prescription done for me without having to actually go into the doctor's office and pay a high copay? I'm all in. Or those 35 and under crew that think that they're invisible, but at least they have this to cover themselves. Or even the elderly that can't afford their medication, or they can't afford the high insurance because they may have pre-existing conditions. You know, here's the funny thing about this, and I don't mean to say it as funny, but I am not a medical expert. In fact, I just found out that we were adding healthcare just a few days ago. But this is something that we all know about. This is something that we all experience. I don't need to be taught about this because we live it in our day-to-day lives, either us and the people that we care about. And now we have a program in place that we can help a lot of people out there. Not just people in the industry of network marketing who need it because they're self-employed, but also friends and family who don't post about their medical issues on social media and who are silently suffering. We have something for them as well, on the retail side and as being a member of the club. This is a movement that we're going to be able to start worldwide because this is something we can bring worldwide. In fact, we'll have Dr. Boyer talk about that in a moment, being able to open up in other countries. We have a team in Indonesia right now that is so excited to hear about this, saying that their healthcare system in Indonesia, we think we have it bad in America, but imagine them having something like this. The demand for this is huge. And how we tie this into the Freedom Club Challenge. By you enroll 5 members at 100 BV, you get a $50 extra bonus. You enroll 10 members at 800 BV, you get a $150 bonus. You enroll 15 people at 80 BV, and that's 1,200 BV, and that's a $250 bonus. What if you're in a situation right now, you say, I can't afford things. You really put your head down for the rest of this month, and you enroll 15 people that's doing 80 BV. And next month when they qualify, you're getting an extra $250 a month. And you use $99 of that to pay for your monthly product membership in the Aroga's Club, which means you now have the health care for free that's paid for. You have another $150 left over to pay one of your bills. And that's not including the compensation plan of you building your business. If you guys don't see a light bulb right now, you should be like me. I can't sleep at night thinking about what we have to offer the people out there. And all we have to do is give it to them. Show them. You can't afford it? Let me show you how to earn it. But you've got to be covered one way or another. Even if you do have health insurance. I have health insurance already. You better believe I'm going to have this as well. Even though I had health insurance, one of my subscriptions, when I was undergoing the testing on why I had this sudden rapid hearing loss, I forgot the name of that medicine, cost me like $70. $70. And the thing didn't even work. What if I was able to get that as a discount? So ladies and gentlemen, what I want to do right now is we weren't able to test this ahead of time. I know Dr. Boyer may not be familiar with this system, but I'm going to unmute or turn his mic on. And Alan, if you're able to, I think you have your microphone. It should turn on in a second. Just hop on in and speak if you're able to. So we can go ahead and do question and answer and allow you also to share the vision a little bit of this program. I think that's him right there. Go ahead and try to say something, sir.
Hello.
I hear you. Yeah, you're there.
Oh,
I hear you.
I'm here.
Great, great. Well, I want to turn the floor over to you. You and your business partners have put this system together. Been working it for 5 years, and we're bringing it to Aroga's Club. And we had you on Groves Avenue earlier today and share a couple of things with everybody. And I want to give you the platform to be able to share again with this group here, because this is evening time for America, so we have more people on tonight in America. And just share your excitement for the program, your vision for it, and what it's going to do for our members here.
Well, thank you, Brandon. And just send me a text in the chat if this is echoing or is not clear or anything, so I have a good reference point. But yeah, good evening, everybody. Let me just say, if I were any more excited, your computers and your microphones would be blowing up right now. This is like a home. It's like arriving home for me because I love healthcare. I love healthy people. I love doing my bit to assist people in becoming healthy, but I also love helping people to earn dollars every month so that their personal utility is improved and they can, pursue wholeness, not just happiness, but wholeness. Because really, we're in a crisis around the world, but especially in America with healthcare. I mean, who knows what's going to happen to it? And I'm not going to make any political statements. That's not my style. But we just don't know what's going to happen to the Affordable Care Act in the United States. What I do know is that it's a mess. And having something that's constant, that you can rely on, that's there for you at your fingertips 24/7, to me gives me peace of mind because I know that I can just in the middle of the night, if I have something going on with my health, I can make a call and have a board certified doctor calling me back or picking a phone up within maybe 10, 15 minutes in the middle of the night. So I just want to give you two quick stories, and I hope this resonates with you and shows you the power of this program. Crosby, who is one of our founders here, and unfortunately couldn't be on the call tonight, Brandon. He's still traveling. Greg loves being in the water. He loves playing golf. He was in a swimming pool and started to get water in his ear, and he knew that could turn into something very, very painful. So he got out of the pool, just dried his hands, dried his hair, got on his phone into his app, and he connected with a doctor. Doctor called him back within a few minutes. He explained what had happened. The doctor said, "Yeah, you've got water here. You need to get that arrested right away." Oh, I see you. Oh, where are you? He told him where he was. He said, "Okay, your nearest pharmacy is I don't know, a couple of miles away. I'm sending a prescription for you to get this medication, this assistance. Just go around, pick it up." Greg got dressed, went round to the pharmacy, presented his RX, his pharmacy discount card, got a huge discount off the medication, the ear drops, and then went back and got back around the pool. It all happened within an hour. All happened within an hour. And Greg's happy. Greg's happy. He's getting his ear fixed. He got a great discount. He didn't have to go to ER and go and find a doctor because he was out of town and out of state. So therefore he has health insurance, but if he'd gone to a doctor out of state, it wasn't in his network, he was probably going to be paying an absolute fortune for that. That's a great story. There's another story that Greg's friends, their son got married. Son and daughter-in-law came back from honeymoon. Daughter-in-law called mother-in-law in excruciating pain very late at night. Turned out she had a urinary tract infection. Mother-in-law said, "You need to go to ER right away. You need to go down there, get that sorted out quickly." Daughter-in-law said, "I'm 20 minutes away from a hospital or ER. I'm going to be sitting there for probably 3 hours, and it's going to cost maybe $200, $300, $400. Is there another solution?" If only she'd had our program, if she'd been a member of our program. Now, mother-in-law didn't know anything about the program because they haven't seen Greg for a while. But you see, there's a great solution, and there's an, oh dear, if only. She could have saved $100 because husband could have just gone down to the local pharmacy, picked up the medication, brought it back. She would have been able to stay in bed, obviously in pain, but less in comfort. She would have been taken care of right away, and the medication would have gone to work. You know, two great stories. One, a solution, one, if only. You know, it behooves us to tell everybody we know about this solution, because I believe that if I have some information that is of advantage to me, I have no moral authority to keep it to myself. I need to be sharing it with people, because they're going to thank you for doing that. And they're going to come back to you and ask you next time, hey, do you have something for this? Because you become an advocate to them. You help them a great deal. So that's a little bit about the program, two practical, two real examples. Putting this into Aroga's club is like a dream come true for me, because it is absolutely amazing. When I first heard of Aroga's club, I met Brandon on the phone just a couple of days ago, met Adam, met Grove, and it was just, they're saying all the right things. If there are 1,000 line items to check off, they hit 1,000 plus bonuses. They got extra credit, and it just felt that it's the right place. Adam said this morning that he hasn't slept well for 2 or 3 nights with excitement. Neither have we, folks, because, you know, we're very happy to bring this to you. We're very happy that this is going to provide solutions. We're very happy that you can increase your personal utility and make a few extra dollars, spread the good word, feel good about it. I could go on and on and on, and I'm just excited. Now, Charles just left a chat question. How soon after a person signs up can they use this healthcare service? As soon as you sign up, as soon as you hit submit, you will get an email and you can start using it right away. So it's pretty immediate, because you'll have a code that you can start using. We suggest that you don't wait until you've got a urinary tract infection or some pain or something, or you sign up. You know, get it right away. But it is very easy as fast as that. But we will be sending out an Aroga's Club membership card that you can carry around with you as well. And you download the app, download the phone app, so you have it with you wherever your phone is as well. So now, we're excited. Let's love any more questions you might be able to.
You just said something powerful, sir. You said the phone, downloading the phone app. Can you explain to everybody how that works and what the app itself can do? Because we didn't even talk about that earlier on Groves Avenue.
Well, yeah, the app is it's just easily downloadable, and it just means that you go into it. You can search for different doctors and services and things like that. So it's a library full of good information, and it just puts everything at your fingertips, basically. So it's just like any other app, Brandon. You know, it just has that library of information, and you know, we're hoping to build the app as well to have good hints and tips on how to get healthy, stay healthy, and you know, so you don't necessarily even need to use the teledoc service, or you know, things like that. The other two things as well, the discount vision and the discount dental, are also very powerful. And also, I'll tie this back to the app, Brandon, and all of the other services that are available. You know, you're not going to be able to remember those, so you just go into your app and say, okay, I'm out here. You know, what do I do here? You're talking to somebody that's smoking, and that's a smoker, and they'd love to stop smoking. They don't know what to do. Well, you can just go into your app and show them, you know, the services that it offers. So it's also like a marketing tool for you as you're talking to people. You don't have to have a photographic memory and remember everything that this does. It's just a great aid memoir. It's a great tool for you to just, hey, let me just see if we do this. Yeah, oh, look at this, we do. This is how you sign up. So I hope that kind of explains a little bit, Brandon. Ray just asked, oh, sorry, I had a couple of other questions. Any exclusions on pre-existing conditions? No, no, not at all. If you have a pre-existing condition and you need a treatment or service, then just go. You go into the app. You'll go into call the doctor and just talk to them, and they'll help you in all way. You'll still get discounts on your prescription medications too. Yeah, and there's a number for questions. And how long before this goes global from Ray? Well, we're working on that, Ray. We need to have a certain number of members in any particular country, because whilst you can make 10 calls to a doctor every single day, or 20 or 30, and it doesn't cost you a penny because it's included in your membership. Every time you make a call, we will pay that doctor quite a bit of money. Doctors are not cheap, so we pay them quite a bit of money. So just from scalability and economic balance, we need to have a certain number of doctors, and I think sort of members contributing to the pool, so that we can then make sure that the service is always available. I can't remember what the number is, but it could be something like 5,000. So, if Colombia would like to have that service, Canada, Switzerland, whatever, then we just let us know, and we'll work in that country to build that database of physicians, and there's a lot of work goes into it. But we've done it in the United States, so we can do it again in other countries, and we're planning on doing it in others as well.
That is fantastic. Thank you for sharing that. And if you guys have any other questions, please type that in the chat box. You should notice on the websites, everything should be updated. There might be a couple of changes here or there where you can go ahead and look at the service. All current members, what you need to do, you're going to have to activate this service for the first time, which means you're going to have to pay the 29 or the 39, whichever one you choose. And then on your monthly, you'll choose your what monthly membership package you want to have. So as it stands now, I want to give you an example. If somebody just like the travel and just like the regular membership, that all they want to do is just healthcare, it's $99 to join, and either $29 a month or $49 a month. The $49.95 is not only healthcare but also travel. So you get a travel pin and you'll have your healthcare. If you do the $99 a month, the new $99 a month, it'll include travel, healthcare, and you'll get a 6-pack sample of the holograms. We're also going to have what's called like a shopping cart, where you can mix and match all of our product and services that you want to have, and they all have BV tied to them. And it's very important to note, to participate in the Freedom Club Challenge so that you can earn these bills to be paid, you have to be doing at least 80 BV. So the $29.95 membership for healthcare is going to give you 20 BV. The $49 membership is giving you 40 BV, and the $99 is giving you 80 BV. That gives you all of it. Let's say somebody that wants to sign up wants to be able to have access to all of them, meaning the healthcare, travel, and also the holograms. We have the $199 package does that. The $299 and $399 just gives you more product in the holograms and VIP service at the $399. But it really starts at $199, and that's the one we want to point everybody to. $199 to join, $99 a month. You gain access to everything that the Aroga's Club has to offer. So Anne-Marie says, healthcare monthly fees apply to 80 BV, part of it. So if you're doing just $29 a month for the healthcare, that's 20 BV. If you're due $99 a month, which includes healthcare, then that's 80 BV. So it's also healthcare, holograms, and travel for $99 a month. So that's the package, that's the deal. Now, also, Dr. Boyer, a couple of questions I know people might ask is, and I want them to make sure they understand this, what's the benefit for them if they already have health insurance? Is this something that can still be of benefit for them?
Well, yeah, I absolutely believe it is. And I know I know quite a lot about health insurance. Coming from the United Kingdom in 1998 over to the United States, I I was shocked how how important health insurance was in the United States, even in a company that somebody worked at. And so it was completely strange to me because, whether there's good, bad, and ugly in everything, and there was good, bad, and ugly in the healthcare system in the United Kingdom, but nobody was ever bankrupted because of inability to pay co-pays or their share of, like an 80/20. If you have a $100,000 bill, you've got an 80/20 copay, you've got to find $20,000, and the hospitals will hound you for that. And if you can't find that $20,000 or whatever it is, the only option is maybe bankruptcy, and that's a horrible thing to have to face because of what it does to you for getting loans, for getting a mortgage, refinancing, things like that. And the majority of bankruptcies in this country, in the United States, are due to inability to pay medical bills. And about 45% of those bankruptcies, people had health insurance. So it costs a lot of money and can create absolute chaos and catastrophe inside a family. Now, we're not going to sit here and say that this will avoid bankruptcy for somebody, but it'll certainly reduce the amount of money you have to pay in circumstances where you could utilize this program and not have to go to an ER, take big discounts on any monthly medication that you have to pay out for. And medication can cost an absolute fortune. If you're diabetic, it's a lot of money. If you have um, uh, uh, issues as a result of diabetes or high blood pressure or whatever it is, it costs a lot of money. Acid reflux, costs a lot of money. So to get discounts, it can assist you in avoiding getting into a financial situation where your back's up against your wall, you're losing sleep, you're getting sicker because of it, it's ruining relationships, causing you to underperform at work. This financial uh, release, if you like, or aid can really assist you. So absolutely, if you have health insurance, absolutely have this system. And remember, you also get other benefits like pet care. People pay a fortune to have their pets taken care of. I wrote a white paper and did some research on a white paper for a friend of mine who was wanting to design a multivitamin. Tasted like bacon. It's pretty good actually. I tried it, made my hair and my nose and my hair shiny. But it was a great product. It's a spray multivitamin, and he was wanting to sell it to some big companies. So I did a white paper for him to help him out. I was absolutely astounded how much people pay to have their pets taken care of just on an annual basis. In fact, one of the things I found was that a large majority of people pay more for their pet care than they do for their kids' health care. So, even just to have a premium version, the pet care program can save a heck of a lot of money. So it's not just about, just your own personal health. It's these other benefits that are being offered on top of the 24/7 teledoctor, the discount, the vision discount, and the dental discount as well. It's all those other benefits that make a huge difference in cost saving. So yeah, if you've got health insurance, this gives you peace of mind. It's a constant. It's there for you wherever your phone is. So yeah, absolutely. I would suggest that you seriously look at this.
Fantastic. Thank you for sharing that. Anybody else have any comments or questions? I know we covered a lot of information today from Groves Avenue and also from the information tonight. And I wanted to keep this short and sweet for you guys. Just to give you an introduction, we'll be having a more detailed presentation for the entire Arogas Club, which will include the healthcare into our presentations tomorrow night for our Thursday night cutoff for our power line. Does anybody have any other comments or questions? I'd love to hear feedback. Who's excited about what we're doing? That this program includes all 50 states. Does it include U.S. territory? How about that, Dr. Boyer?
Please just help me out. What's U.S. territory? Puerto Rico? Yes, I believe it does. I'm sorry. Forgive me, I'm still learning geography over here. It's certainly all 50 states. I'm pretty sure it includes Puerto Rico. Not sure about Guam, but these are great questions. If you'd allow us to just research that. Between Greg and I, we pretty much know everything about this program. Unfortunately, Greg knows some of those answers to those questions. So please forgive me being able to be completely decisive on that, but we will find out and get back to you. Brandon, I assume you've got a way of communicating with everybody responses to some of these great questions.
Yeah, so as soon as we get answers, then I'll definitely get it back to them, and we'd love to have you and Greg on sometime, probably next week. We'll do a special training once everybody by that time will already have purchased their health care. We'll be playing with it, taking a look at it, and they will definitely have some questions again next week. But I think we'll go ahead and cut it off now because we're going on 40 minutes after. So I definitely wanted to thank you for coming on board with us. Thank you for bringing this program to us, and we're ready to rock and roll with it and get it out to the public. Any last things you'd like to say, Dr. Boyer? We'll go ahead and dismiss.
I'm just incredibly excited to be bringing what I consider a great solution, into Aroga's Club. Just love working with you. I will be present as often as I possibly can, and so will my colleagues, because we want to support you. We want to make sure that this works. We want to make sure you get the very best out of it. So, like it or not, you're going to hear a lot from us. So we're excited about this.
Fantastic. Well, thank you everybody for joining us. We will see you tomorrow. Remember, we've got, I know Adam's on his way to Vegas right now. See if he is doing the club hangout tomorrow morning. But tomorrow night, 9 p.m. Eastern, 6 p.m. Pacific, right here on www.arogatoday.info is our Thursday night cutoff presentation. We will be featuring the Healthcare Club, and bring your guests. Bring everybody out to see this. We actually have an app that you can download as well that's part of the program. I think that is, I don't know why. I heard that before. It just didn't click in my head until I just heard it again right now. And that just gives the value and the possibilities just went through the roof in my mind. So I'm very excited. I hope you guys are as well. Thank you, Dr. Boyer, for coming on. We will see you all tomorrow night. God bless. Bye-bye.